Hey, Dr. Jerry Williams, Urgent Care 24/7, here to talk to you a minute about abdominal pain. Well, listen, talk about a broad topic. There are so many things that can cause abdominal pain, both chronically, which is really a bummer, those people who have abdominal pain all the time over an extended period of time, and acute onset of abdominal pain. Right now, we're going to try to concentrate just on the acute onset of abdominal pain and what should you do if you've got an acute abdominal pain situation. Now, listen, it's very different whether it's a child or whether it's an older person, male and female. Also, very important because women of childbearing age, one thing that can cause abdominal pain is an ectopic pregnancy. That's where the embryo actually implants outside of the uterus along the fallopian tubes, for example, or on the ovary, or can implant in actually the abdominal cavity. So there are lots of different reasons that can cause abdominal pain. A lot of gastrointestinal problems can cause abdominal pain, but not just that. Bladder problems, urinary tract infections can cause abdominal pain. There are actually blood vessel issues that can cause abdominal pain, though unlikely, there are causes such as abdominal aortic aneurysms. There's also problems with your kidneys. Kidney problems can cause abdominal pain. And then there's some idiopathic abdominal pain syndromes that are nerve related that can be related to a large amount of acute weight loss and other more rare circumstances. And there are medical conditions that can cause abdominal pain just as a symptom of the illness. So it's an extremely broad topic. But I'm going to give you some kind of thumbnail things to think about if you've got abdominal pain and you're trying to figure out right now, should I go to the emergency room? Should I go to urgent care center? Or should I go get seen by my primary care doctor? What's the right answer? Well, first of all, time of day is important because if it's 2 o'clock in the morning and you don't have an urgent care center open in your community, your only option right there at this point is either to wait it out or go to the emergency room. And I tell people always, better safe than sorry. If you think you're having a life-threatening illness and the manifestation of your illness is abdominal pain, by all means, dial 911, or if you think that it's safe, either get to the emergency room through friends or family or yourself if you think you could safely drive. But if not, always dial 911, get the ambulance to take you. Now, in regards to abdominal pain, some common things. I mean, gallbladder disease, peptic ulcer disease, ulcers in your stomach. There are all kinds of gastrointestinal upset from a dietary indiscretion. It means you go to the ball game and eat one too many chili dogs and drink a couple of too many beers. Those kinds of things are incredibly common. And think about what you've eaten recently. Could that be the etiology of or the cause of your abdominal pain syndrome? Also, in the case of other symptoms, do you have nausea, vomiting, diarrhea? Is there any blood or mucus in your diarrhea? Not fun stuff to talk about, but incredibly important. If you vomited, was it food? Or did it look like coffee ground material? Or did it look like blood? Was it red? Those are all incredibly important things that you need to put into the equation as you're trying to make a decision on whether you should seek emergency care now or can you wait and see your primary care doctor or an urgent care center the next morning, for example. In the case of pediatric abdominal pain, actually a very common problem, and in some cases attributed to quote unquote growing pains. But abdominal pain in the pediatric patient is actually a very real thing and is something that needs to be evaluated by a medical provider that's comfortable seeing pediatric patients. Most commonly, constipation, gastrointestinal disturbance, most common thing with kids with abdominal pain. But there are other issues that can arise as well. So really important that if you have abdominal pain as a primary symptom, that you get evaluated by a medical professional in a timeline that you deem appropriate based on the severity of your symptoms and how long it's been going on. And also any other comorbid conditions you may have, any other illnesses that you may have that can complicate matters. So always, when in doubt, be conservative. Get yourself evaluated immediately at the fastest, most reliable place, emergency room being the most common standby, or an urgent care center if they're open, or your primary care doctor. I'm Dr. Jerry Williams. I hope your tummy pain feels better, and please be sure to get checked out. Urgent care 24/7. Life is 24/7, and so are we.